Welcome back to more news on ASEAN TV. Now, the spread of HIV/AIDS through the sharing of needles among drug users is a major problem in Southeast Asia. And in this next story, we visited the resort island of Bali to observe how the Indonesians are tackling this issue after a radical shift by the government in 2007 by recognizing drug users as victims rather than criminal. More in this report. The beautiful sceneries and the enchanted beaches famously associated with Bali by tourists the world over does not reveal the darker side to this piece of paradise of sea, sand and sun, the endemic of HIV/AIDS that took root on this island since the late 1980s. It was here that the deadly virus was first discovered in Indonesia. Since then, the Indonesian Health Authority adopted various harm reduction measures to curb the spread of the disease, which apart from sexual intercourses, is commonly transmitted by the sharing of needles among drug users. Out of the 186,000 HIV cases in Indonesia in 2009, 105,000 are drug users aged between 15 to 49 years old.
January 2007, we agreed to declare the national policy on the harm reduction, including needle syringe program, and then needle syringe programs agreed to take place in the across country, based on the community health center like Puskesmas Kuta Bali.
Under the initiative, drug users can come to receive counseling daily at a local government-run clinic. They can give used needle to health workers to be disposed of properly and receive new one in return. Some who wanted to rehabilitate themselves joined the methadone treatment program, trading their needle habit with doctor-prescribed methadone syrup, a yellow-like substance extracted from opium used as substitute for narcotics like heroin, a treatment that costs only about $1 a time. So far, over 900 community health centers across Indonesia offer this kind of treatment, and right here in Bali, over 800 out of 3,500 estimated drug users on the island are registered for this treatment. Health authority here said that so far, this treatment is bearing fruit in reducing the number of AIDS infection as well as drug users because of the support received from the local police and the community.
At the moment, I'm proud that we at the moment went on the track, and of course we need more support from wherever, from donor, from government national, and from provincial, and from all the community, especially this from the community, from the police. And we are lucky they give us a good support at the moment, especially from the police. Even we doing more and more advocacy, talk with them, communicate with them.
Key to Bali's success is the existence of safe house like this one. Run by a community of drug users, Yayasan Kesehatan Bali is a privately run health foundation that offers clean syringes as well as information regarding narcotics and HIV/AIDS to addicts in the community since 1999.
Drugs issue is still a problem in our country, so that's why we talk with some, especially for drug user community, how to make, because their involvement is very important. So that's why we push them to involve in this action too.
The ethos of active involvement by drug users in the harm reduction process has also been embraced by the health authority, seeing reformed drug users as an important bridge between the street and the clinic, curbing the number of HIV/AIDS infection through drug abusers in the future.
Methadone is very good because I'm not sick again, and I don't big money, because the methadone is cheaper, not cheaper, and I can walk, I can go anywhere I want, and I can do anything I want. Basically, I clean myself, and many friends see or like a role model and follow me. Just like simple.
The approach to harm reduction seen here in Bali, Indonesia, is an example where trust is built between drug user, the authority, and society at large. And this is something that could be emulated elsewhere in Southeast Asia. I'm Wongcha-um of Thai News Agency, reporting for ASEAN TV from Denpasar, Bali, Indonesia.